Hi, my name is Dr. Sabrina Gerkowicz, and today I would like to speak with you about donor egg. My goal is to provide some basic information about what it entails, what are the different options available with donor egg cycles, as well as some of the pros and cons and what to expect with that. So hopefully that will be helpful to you, and we'll try to crunch it all into just a couple minutes. So why would somebody consider a donor egg cycle? So there's definitely a lot of indications, and it's a very personal decision, but some of the most common reasons where donor eggs might be suggested in terms of a fertility treatment option would be for individuals who have experienced premature ovarian insufficiency, or formerly known as premature ovarian failure. In addition, women of advanced reproductive age, much more so after the age of 42 and beyond. Individuals who have certain genetic conditions that might be passed from the egg to a future generation if genetic screening is not something that is an option or is not available. People who have low or diminished ovarian reserve could benefit from egg donation depending on the situation. And for some individuals or couples, they have undergone multiple IVF or ovarian stimulation cycles without success. Those might be couples that might consider egg donation. Also, male couples who are interested in building their family, using an egg donor with a surrogate would be a very clear indication. So with that being said, an oocyte donor is typically a young and healthy woman who is doing this voluntarily and out of goodwill. They are healthy. They are screened for various sexually transmitted infections, medical conditions, family histories. All of these aspects about that individual's life are very carefully screened to make sure that the oocytes are coming from somebody who is healthy. On average, women who are undergoing an egg donor cycle tend to be in their 20s. You don't have to have had previous children to qualify for being a donor, but definitely being healthy, having regular menstrual cycles, not having any gynecologic or significant medical comorbidities or illnesses, and certain social behaviors, including smoking, definitely cigarettes, drugs, vaping, even tattoos, or any of those factors that might put one at higher risk of contracting a viral illness. These things are really heavily screened, and it's critical to make sure that that risk is reduced. So the FDA is in charge of this, since this is technically a donor tissue. So these requirements have to be met. It's also very important, and it's not to make things more complicated, but rather for everybody's safety. So that is typically what you would expect from an egg donor. And with an egg donation cycle, it's also really important that the recipient, who will be planning to have that donor egg fertilized and then transferred as an embryo into her uterus, you really have to make sure that you're doing a thorough fertility evaluation as well. So you want to see that the fallopian tubes are healthy. You want to make sure that the uterine cavity is optimized, and definitely any preconception screening, including health, medical, and all of the first trimester screens that you would do. You want to have all of that up to date. Pap smears, mammograms if indicated, etc. You all want that to be up to speed prior to preparing for that embryo transfer. And certainly the recipient's partner, if it's a male partner, and if sperm are going to be used to fertilize the donor eggs, all of the same requirements are necessary in terms of a fertility evaluation on the male, a semen analysis, and all of those preconception screens are important. So all of that stuff has to be done before getting started. And there are some additional considerations. So that does include legal counsel and psychologic counseling or evaluations. And these again are not done in a way to create more barriers, but rather to provide resources and to make sure that all parties involved in this process are really clear on what the expectations are, on what the roles and everything is very clearly outlined. So it's for safety, for protection, for clarity. So all of these steps are really important. And the psychologic screening or evaluation is also invaluable because there are many questions that possibly you haven't considered. And it's important to explore that or discuss that with someone who's specifically trained in this realm so that all questions can be asked and figured out ahead of time. So it's really, again, supposed to be helpful and really protective of everybody involved. The other major thing to consider is the different types of egg donation cycles. So typically it's stratified into two big categories, known and anonymous. So we'll start with known. Known donors typically are friends or family members that the individual or couple interested in undergoing an egg donor cycle, they know. And with that, this friend or family member has gone through all of those same screenings and all of those same processes, including all FDA requirements, because this is still donor tissue, and they undergo a controlled ovarian stimulation cycle where they take injectable fertility medications and the follicles grow, are stimulated, developed, and that individual undergoes an egg retrieval where all of those follicles are aspirated under anesthesia. The eggs are then taken into the laboratory and then fertilized either with partner sperm, donor sperm, or however that part is happening for that individual or couple. So this is a familial agreement or, friend or family arrangement, but that stresses even more the importance of the legal and the psychology aspect of this, because certainly making sure everybody knows how they feel comfortable moving forward with this process once those embryos and once those children are born, what kind of interaction might they have with that individual? What kind of relationship will they have? These are all really important questions to explore beforehand. So that everybody's armed and equipped to be as comfortable with this process as possible. The second option is anonymous. So this is where you do not personally know the woman who will be undergoing the ovarian stimulation. So these people that are anonymous to you, you are able to through different agencies to see typically some baby pictures. So you would not necessarily notice them if you see them walking across the street. They undergo the cycle, and it can either be a fresh or a frozen egg cycle. And with the pros and cons to both, so a fresh anonymous donor oocyte cycle means that once they have been selected, they go through the IVF process, and oftentimes that can be synchronized to the recipient's uterine preparation. So while the ovaries are being stimulated in the donor, the uterus can be stimulated and prepared in the recipient so that the timing is coordinated to where once those eggs are retrieved and fertilized with sperm and grow to the blastocyst stage, the uterus of the recipient is timed and ready for a fresh embryo transfer. And there's pros and cons to that, but for a fresh embryo transfer, genetic testing is not going to be done. You also get all of the eggs. So whatever is stimulated, whatever is retrieved from that donor in that cycle is all yours. So a pro to a fresh donor cycle is typically higher number of eggs, all from the same person or the same donor. But with that, there tends to be fewer of these donors immediately available in your area to undergo this controlled ovarian stimulation at the time when everything can be coordinated. So you might have fewer options in terms of selecting a donor. That will be based on donor availability. So that's definitely one of the cons. But one of the pros is more oocytes and having that option of having a fresh embryo transfer synchronized with the donor. It might also be a little bit more costly since you are going or having to compensate the donor for that entire controlled ovarian stimulation process and the egg retrieval. as well as the embryology portion. So factors to consider with that. The other alternative in anonymous donor oocytes is undergoing a frozen donor oocyte cycle. And that basically means that these donors were selected, screened, all of those same rigorous requirements have been met. They underwent this controlled ovarian stimulation already. The eggs have been retrieved and they are frozen. And typically when you choose this path, you can purchase vials, usually of 6 oocytes. The pro is this is immediately available. You can look at the donor banks, you see which donors have gone through these cycles, which oocytes are available to you. So you can select the donor, know how many oocytes are at the bank and available to purchase, but you have to buy them vial by vial. You are more restricted in the total number of oocytes that you will get. And also with that, then the reason why they come in that number per vial is that ideally from the time the egg is thawed, fertilized, and grows to a blastocyst stage, there should be one embryo created from the eggs in that vial. This is never something that can be completely guaranteed, but different donor egg agencies have different rules or guarantees in regards to this. But that's an important thing to consider, that with these eggs, you're hoping to reach the stage where you have one embryo to transfer. If you have more, that's a great bonus. So those eggs are frozen, you purchase them, the frozen eggs arrive to your fertility center, your uterine preparation is done, and then at the appropriate time, those eggs are thawed, fertilized, and grown in the lab to the blastocyst stage. So again, the pros of the frozen is the immediate availability. Really, you could be ready to go within 1 to 2 months. So timing is certainly a big factor here and definitely varies center per center. With donor oocytes, one of the major pros to undergoing that as a fertility treatment is the chance of pregnancy. So using a donor who is in her 20s and who is very healthy and without any known gynecologic conditions like endometriosis or other things that may factor in or impair oocyte quality, the quality of these oocytes is as good as it can be. So the chance of genetic anomalies, which is the #1 cause of miscarriage, tends to be lowest in this age group, although it's never 0, but it is an age group where usually 60 to 65% of the embryos generated have a chance of being genetically normal. So typically genetic testing is not something that is as recommended using donor eggs, given that there is a greater than 50% chance that the embryo will be genetically normal. So that is a question and a discussion to have with your fertility doctor if genetic testing is still something that you might be interested in. Whereas women, once they exceed the age of 35 and more so after the age of 37, 38, genetic testing does become recommended because the chance of genetically normal embryos from those eggs starts to decline and decline more rapidly to where it is now less than 50 and often lower for the older age groups. So something to think about. So overall, donor eggs have a lot of pros. They are certainly an amazing option for certain individuals and couples. And if any of those criteria or conditions met at the beginning are present, then this certainly can yield the highest chance of pregnancy out of many of the available fertility treatments. You have the opportunity to carry the baby and experience the pregnancy and the delivery and the birth, and the environment in which the fetus and the baby are growing is your own. You control that environment. So it really does provide individuals and couples an amazing opportunity to have their child and to start their family that way. With that being said, it's a really complex topic, and that is why there are all these different layers in place for protection and just to make sure that everybody feels really comfortable undergoing this process, because it is a big step and it might not be something for everyone, and that's okay. But it's important to know about the option. It's important to talk about it and get a lot more information about it from your fertility doctor to see if it's something that makes sense to you. And at that point, you have the right to make that decision based on the information that is provided. So overall, it's a really great option. Success is very high. You still have a lot of things to evaluate and to optimize prior to the embryo transfer to try to ensure that you get the highest chance of pregnancy or the highest chance of success. And there are certain age restrictions at which these embryo transfers from donor egg cycles can occur. So it's really important to talk to your doctor and talk to your fertility center about what rules they might have. So certain age cutoffs could be up to 51 or 52 years of age. Again, this depends on every center. There might be some BMI or comorbidity or health reasons that might need to be optimized prior to undergoing this embryo transfer, only to ensure that you have the highest chance of pregnancy, the lowest risk of complication, and all of those positive outcomes. Those are the reasons why those rules are in place, but they do vary from center to center. So really important to talk about with your doctor. I hope I touched on most of the topics. Donor egg is becoming more and more common in our space. It's really important to know that. And last point I almost forgot to mention is that this is a very private situation. It's a very private decision, and certainly anything that happens in the fertility office or with your doctor, nurses, medical assistants, everything within our office is confidential. So those decisions on how to share information or what you want to disclose with family and friends is your decision. So another thing to reassure that this is a very, very, very private matter, and we take it very seriously. But know that in our world, these donor egg cycles are increasing in frequency and can account to about 10 to even higher % of the number of assisted reproductive cycles that happen in the United States per year. So that's good to know. So hope this was helpful. And if you have any questions, do not hesitate to reach out to us. That is why we're here.